Hi everybody, it's Dr. B here, and today we're going to be talking about Invisalign or clear aligners and things you should know before you start. What exactly is Invisalign? I have my model here. Invisalign, clear trays that fit over your teeth super discreetly. The only way someone's going to see them is if they are directly in your face. They fit in, they're discreet, they're clear, and it's like a clear braces, so it helps move your teeth discreetly over time. With Invisalign, sometimes we'll place buttons to help anchor the trays and help move your teeth. So this is essentially what Invisalign is. It's a great orthodontic option for patients that are a little bit older, patients that are on the news or are engaged in public speaking, and they don't want to have traditional braces. Another really great thing about Invisalign is it allows you to visit your dentist every 6 months for good cleanings. It allows you to brush and floss well at home, and you have regular oral care with Invisalign. So, Invisalign, excellent choice. So how exactly does Invisalign work? Invisalign, usually you'll come in for a consultation, we'll do x-rays, we'll scan things, we send it off to what we call a clin check or a clinical check, where we work with Invisalign, we write a prescription, and we're looking on how we're going to get your teeth into that perfect alignment. Once we do that, we've placed an order, we get a set number of trays. Invisalign treatment can be as little as 3 months to as long as 12 to 24 months, right? Depending on the case and depending on what we're trying to achieve. And it is a series of aligners, and the number of aligners vary with every treatment. We usually ask patients to change their aligners every 7 days, but every dentist is a little bit different. Some dentists prefer every 14 days, but for me, I ask patients to change out their trays every 7 days. So when you come in for an Invisalign, you've had your clin check, we get your aligners back, we're calling you in, hey, we're ready to deliver your case. Hope you're excited and ready to start your Invisalign journey. Usually that first appointment, we may have to do what we call interproximal reduction, where we're just removing a little bit of enamel between your teeth that's going to help create space to help your teeth move, and placing the buttons. Those buttons are composite or resin material that we place on your teeth, and that just helps anchor the trays to allow for better tooth movement and stability. You may even have to wear elastics like you do with traditional braces with Invisalign, depending on your case and what we're trying to achieve. So there's several different things that happen. So we'll give you a set of trays. I usually give my patients trays for about a month, 4 to 6 weeks typically, and then we set up a recall appointment or an adjustment, just like regular braces. At these adjustment appointments, we may have to do some modifications, we may have to do some more interproximal reduction. It all depends, and it's all based on a case-by-case basis. So usually it's just giving you more trays, making sure everything looks good, feeling good, seeing how you're feeling, addressing any of your concerns, and then we move on and we see you in another 4 to 6 weeks. The biggest thing that we have to have from a patient, and this is why sometimes you're not a good candidate for Invisalign, you have to be consistent and committed. Invisalign requires you to wear the trays 22 hours a day. The only time you don't need to wear the trays is if you're eating something and you take them out to eat, you brush your teeth, or at least rinse your mouth, and you put the trays back in. It's just like traditional braces. There is an adjustment period. Your teeth can be a little bit sore. They can be a little bit sensitive, but you have to be committed to wearing the trays. We can't lose the trays. We can't skip weeks because it causes fit issues. It causes bite issues, and it delays our treatment. So if you know you are someone who is not consistent or someone that has a few commitment issues, you may want to consider traditional braces over Invisalign because it does require that dedication and that commitment, wearing the trays 22 hours a day at minimum, and also coming to see us for new additional trays every 4 to 6 weeks when you're supposed to. So what can we expect during our Invisalign treatment? It's very, very similar to traditional orthodontics in the sense that your teeth are going to be sore. Your teeth can also be sensitive to temperature, just a little bit. That's because your teeth are moving, right? So the ligaments that hold in our teeth, those are sensitive. Our teeth are tender. It will get better in a few days. You can manage it with a little Tylenol or Motrin. You have to keep up your oral hygiene. It's much easier to do with Invisalign because you can take those trays out, you can brush, you can floss, you can come to the dentist every 6 months. We're not cleaning around brackets and wires. So keeping up with your oral hygiene is going to be really, really important. And know that refinements may be necessary. So you have to be committed, but even at the end of your treatment, if there's something that you don't like about your smile, or if there's something your dentist wants to change or modify, you may have to enter a period of refinement. And last but not least, once you've finished your Invisalign treatment, just like any other orthodontic treatment, you have to wear your retainers. Must wear the retainers. Without wearing the retainers, your teeth will go back to the position that they were before. It's kind of like building muscle memory. So not only do you need to be committed in keeping your mouth clean, wearing your retainers, coming in to see us regularly for your aligner changes, dealing and managing with some of the post-op or some of the discomfort that comes along with Invisalign, you also got to make sure that you get those retainers, you wear the retainers like you should, and maintain your oral health. So Invisalign clear aligners, a great option for people that want discretion, but want to enhance and improve their smile and change the alignment of their teeth. Also a great option for people that really want to stay on top of their oral hygiene, and you can do a better job with Invisalign than you can with traditional braces. The biggest thing is obviously, like we've said, commitment and consistency. 22 hours a day, coming in for those adjustment appointments, and also wearing our retainers. Definitely going to have a little bit of discomfort, but it should not be anything that is uncontrolled, with a little Motrin and a little Tylenol to help you achieve the beautiful smile of your dreams. So if you're interested in beginning your Invisalign journey and on your way to a straighter, brighter smile, give Bellissima Dental Boutique a call at 910-778-1229 or schedule an appointment online at boutiquedentalandimplants.com.